If you've ever stared down a stack of exams, you know the feeling. By the 100th paper, your brain is running on pure autopilot. But in that rush, we tend to blur four very distinct scientific concepts: measurement, testing, assessment, and evaluation. We use the words interchangeably, but in psychometrics, they represent different stages of the decision-making process. Collapsing these terms together creates a path to misdiagnosis. If a raw test score is mistaken for a final evaluation, you end up labeling a student based on a single, incomplete sample of behavior. We might say, "I'm assessing students with a test." But look at the actual psychometric progression. We are executing a four-step process. You administer a test, you measure the results, you assess the context, and finally, you make an evaluation. Skipping straight from a raw score to a judgment removes the human element. It turns a simple percentage into a permanent record that may ignore the student's actual circumstances. Let's look at a practical example. Say a high school student hands in a standardized geometry exam and they get a 45 out of 100. Now you have a dilemma. Does that failing grade mean they don't understand the math? Did they refuse to study? Or is there an external environmental issue blocking their learning? Historically, group testing was designed to ignore individual questions entirely. When the military needed to screen millions of recruits rapidly during World War I, they intentionally stripped away personal context to maximize efficiency for the masses. But you're dealing with an individual student, not a million recruits. To find the true meaning of that 45 out of 100, we need to track it upward through the entire psychometric hierarchy. A single number in isolation cannot diagnose a student's potential. It is only the starting line. The first phase is testing. A test is simply the standardized instrument you use to pull a sample of behavior from the student. In our scenario, it's the physical printed geometry exam sitting on the desk. This flowchart shows how the data builds. It begins right here with testing as the foundational input mechanism. Next comes measurement. This is strictly quantitative. It's the rigid assignment of numbers based on predefined rules, literally counting up those 45 correct answers. Together, these steps are your data gathering phase. You administer an objective group test and generate quantitative raw data. It is a highly efficient operation. But this efficiency comes with a trade-off. Raw measurement tells you exactly what happened, but is completely blind to why. Testing and measurement give you speed and scale, but on their own, they offer the lowest holistic accuracy in the entire educational process. That brings us to assessment. This is an inherently qualitative process. It's where you take that raw score and combine it with multiple other data sources, like interviews, clinical observations, and medical history. Going back to our geometry student, during the assessment phase, you might notice they're squinting to read the whiteboard, and you might learn from a counselor that their parents are going through a difficult divorce. Now that 45 takes on a completely different shape. Assessment synthesizes all these inputs to create a holistic profile of how the student is actually functioning. The downside here is friction. Genuine assessment requires a massive investment of time and human resources. You physically cannot perform this analysis for every student on every weekly Bob quiz. But when you need to make a major decision, assessment is the critical bridge. It transforms a raw percentage into a usable human narrative. Finally, we reach evaluation. This is where you pass a definitive value judgment on the data. You take that fully contextualized assessment profile and weigh it against your predefined academic standards. For our geometry student, the evaluation leads to a clear, actionable decision. They need an eye exam and a front row seat, not a demotion into a remedial math program. Evaluation carries high stakes, dictating a student's academic trajectory and their future opportunities. If you bypass the assessment phase and map a raw test score directly to an evaluation, you risk an inaccurate placement. You are passing a sentence without reviewing the evidence. When an educator does need to run a complex formal assessment, they have to choose the right psychometric tool. And these tools split into two distinct categories depending on what you need to measure. This matrix breaks down the primary categories used by school psychologists: cognitive tests, which map maximum performance, and non-cognitive tests, which map typical performance. Cognitive tests are strict measures of intellectual potential or acquired academic skills.
They are timed, they have definitive right and wrong answers, and their goal is to locate a student's absolute mental ceiling. But because they demand maximum output under optimal conditions, they completely fail to account for test anxiety, a lack of motivation, or how the student acts on a normal Tuesday. Non-cognitive tests capture that missing piece. These are personality inventories and behavioral checklists. There are no correct answers here. The goal is to map emotional states, interpersonal dynamics, and baseline traits. The trade-off is that they rely heavily on honest self-reporting, making them vulnerable to subjective biases or intentional manipulation by the test taker. Some non-cognitive tools lean entirely into the subjective. Projective tests use completely ambiguous stimuli to draw out hidden emotional conflicts, requiring an expert to interpret the results. Knowing whether you are hunting for maximum ability or typical behavior ensures you never use the wrong instrument to solve a student's problem. So, how do we practically apply this hierarchy in a school environment where time and resources are stretched thin? This scorecard maps out how different educational professionals can ethically divide their focus across the psychometric process. Front-run teachers move through testing and measurement daily. In this role, a low grade acts as a trigger for deeper inquiry rather than a final verdict on a student's capability. Meanwhile, school psychologists and administrators have the mandate to deploy targeted cognitive and non-cognitive batteries. They execute the rigorous assessment and evaluation phases, especially when high-stakes decisions like individualized education programs are on the line. Empirical data without human context is just a number. To genuinely optimize a student's trajectory, we have to commit to doing the hard work of holistic assessment before we ever pass judgment.